Uh,
Hello, Dr.
yes,
Yassine, one of the doctors in the medicine clinic for today. May I confirm that you are Mr. Ahmed and you are 40 years old?
yes, doctor.
Mr. Ahmed, today we are here to discuss about your health condition and I will be happy to examine you and address your concern. Is it okay for you?
Yes,
It came to my knowledge that you have some breathing discomfort. Can you tell me more about it?
yes, doctor. I have 1 week now of shortness of breath and breathing discomfort.
Okay, I'm very sorry to hear this, Mr. Ahmed. Can you tell me more about it? Did this started suddenly?
Yes, it started 1 week ago, and this was sudden.
And it is going increasing by the time?
Yes, it's getting worse, and it is also associated with some chest also discomfort.
Okay. And this shortness of breath, something increases like exercise or activity
Yes,
or lying
I
flat.
uh,
Mm,
yes, I couldn't complete any activity now. Activity make it very worse. I get out of breath easily. Also,
mm.
lying down make it worse.
So did you increase the number of pillows at night?
Yes, I increased it by one pillow. Now I'm on two pillows.
Mm,
I'm sleeping on two pillows.
okay.
Yes,
And do you have also leg swelling as well?
leg swelling. I'm not sure about this.
Okay. And regarding this increasing the number of pillows, something else make it better, like taking rest?
Sometimes taking rest, yes, make it better.
Mm. And how much you can walk to get this breathing discomfort before you get this breathing discomfort?
Few meters, doctor, maybe 10 meters or less.
I'm very sorry for this. And you mentioned that you have some chest discomfort. Can you tell me more about it, please?
Yes, I have some chest pain. It is mostly I think maybe on my right chest. Every time I take
Mm,
my breath, I feel the pain.
I'm very sorry. Is it since 1 week also?
Yes, it is started associated with this shortness of breath.
Is it increasing by time?
I think it's the same, and I'm trying to compensate by taking paracetamol, make it slightly better,
Uh-huh.
but return back.
And how it looks like? Is it stabbing in nature or dull aching or
It is more of stitchy.
stitch pain? And it increase with breathing.
Yes,
And get relief, how it get relief or
with paracetamol sometime.
was part is it going somewhere else?
No,
With this you have sweating?
sweating. No.
Mm. You have tender muscle on your chest?
What's tender muscle, doctor?
Like you have pain when you touch your chest?
Yes, sometime. Yes.
Okay, right. And did you ever got up in the night gasping for air?
Last night.
Hmm. Do you have any cough?
No,
Ever coughed out blood?
no.
Okay. And may I ask you, did you ever diagnose with any health condition?
Diagnosed? No,
Do you take any medication?
no.
Okay. And do you have a family history of heart disease?
Yes, my dad did a heart surgery, but I'm not sure about what was the circumstances there.
Hmm. Anything else in the family I should be aware?
No, no.
Okay. And do you have any awareness of your heartbeat?
Yes, sometime this week, yes, and with exertion.
And is it going fast or slow?
The effort make it slightly make me slightly aware of the heartbeat. I think it's fast.
Okay. Is it any time goes irregular?
No, no,
Okay. And did you have any high body temperature?
no,
Any weight changes?
no,
Any loss of appetite?
no,
Night sweating?
no, no,
Bumps and lumps?
no,
Anybody told you looks pale?
no,
Yellowish in color?
no,
Any weather preferences?
no,
Any dizziness on standing?
no.
Did you ever collapse with these symptoms?
No.
Okay. Any headache?
Headache? There is some headache, yes, and this have been there for a long time. It is mostly in the back of my neck, and I'm trying to compensate by taking sometimes paracetamol.
In the back of your neck. Like since
Yes.
how long you have this headache?
It has been now for 1.5 years, I think so.
Is it all the time or on and off?
It's on and off, doctor.
Is it mainly morning time?
No, no,
Is it when you lean forward it increase?
no,
Do you feel vomiting with it, throwing up?
no, no.
Okay. And do you have any eye changes or blurring of vision?
Yes, I have double vision.
This is since how long?
This is now for 1 year also.
Like what do you mean double vision? Like in all direction you feel double?
Yes,
Okay, right. And is it painful as well?
no pain.
If you close one eye, this double vision will go?
Yes,
Okay, right. Do you have any eye drops?
no,
Dropping
no,
of eyelid? Can I see
no, no,
my patient?
no, no. You
Okay.
you want to see
Do,
the patient?
yes.
Yes. What do you
Okay.
want to see?
I want to see the patient face.
Okay.
I want to see the patient as a whole. Okay. And going back to this eye problem, is it? Do you have any vision problem in the night time? More
No, nighttime is okay.
color vision problem?
Okay. Color vision? No color vision problem.
No color vision. Do you have any tummy pain?
Tummy pain? No.
Tummy swelling?
Tummy swelling? No.
Any acid brush sensation?
No.
May I ask, do you have any alteration of your bowel habits?
My bowel is okay.
Any water work changes?
No. Water work is okay.
Any joint pain?
No joint pain.
Skin changes?
No skin changes.
And what do you do for living?
I'm a diving coach.
Okay, and how the things affecting you?
I stopped my work 1 year now
Okay,
because
because of these symptoms. Mm.
yes, because of shortness of breath.
Okay.
Because shortness of breath
Very high
actually
risk. Mm.
has been there for 1 year, but this 1 week it is getting very worse. Before that, it was with effort only.
Okay, okay, and you smoke?
Yes,
You drink alcohol?
drinking alcohol occasionally.
Mm. Do you drive?
Yes, I drive.
I would like to advise you to stop driving, as overall it can be very risky, as well as stop smoking, even if a small amount can be risky to your condition. Did you
Okay.
travel recently?
Travel? No.
And do you have any partner?
Yes, I'm married.
Any casual relationship?
No.
Any surgery?
No.
Sharing needles or tattooing?
No.
Okay, can I examine you?
Yes, please.
I need full vital signs of the patient.
Vital signs: blood pressure 110 over 90, respiratory rate is 26, saturation is 92, pulse is about 90 beats per minute.
Is this patient looks like morphinoid or have any pictures of syndrome?
Okay, you can see.
Did you do some procedure before, Mr.
Yes, doctor. I have been admitted for a surgery. It was on my right chest, and this was 1 year ago.
Okay. Mm-hmm. Do you remember what kind of surgery? Did they remove some part of your lung?
I can't remember.
Okay. I need to examine. Is the patient looks tall?
Yes.
Mm-hmm. Can I examine the arm span to the length?
Okay.
Is it
Okay.
proportionate or disproportionate?
No, it is disproportionate. The span is
Okay.
taller than the height.
Okay. I need to examine if the patient wrist sign is positive.
Yes. Wrist sign is positive.
Okay. And thumb sign?
Some signs positive.
I need to examine the pulse. Is it regular?
Pulse is regular.
Collapsing?
Yes, it is high volume and collapsing.
Okay, equal?
Yes, it's equal on both sides.
I need to examine the patient precordium. First, I
Okay.
need to examine the chest
Okay.
from the front and from the back. Any additional sounds? What is the type of breathing?
Type of breathing is vesicular with prolonged expiration.
Okay, is there is any reduced air entry anywhere?
No.
Okay, I need also to ask the patient to check the heart. Is there is any murmur?
Where do you want to auscultate?
I need to auscultate on the apex and on the aortic area number 1 and number 2 and pulmonary area.
Okay. About the apex, yes, there is murmur and there is murmur radiated to the axilla.
Okay, murmur radiated to the axilla.
Yes, there is systolic
Okay.
murmur
Uh,
radiated to the axilla.
any diastolic murmur?
Diastolic murmur, no. Where
No
else?
diastolic murmur. In aortic area?
Yes, there is some murmur could be appreciated in the second aortic area.
Is it increasing while patient sitting and deep expiration?
Yes, it is increasing by expiration and leaning forward.
Okay, I need to examine I need to examine the eye for any dislocation of the lens, and I
Anything,
need to examine the eye
anything else?
movement.
Anything else in
Uh,
the precordium?
Pectus cavatum, inspection pectus excavatum and craniatum. A
Okay.
scar. I
Yes,
need
there
to
is a
see the
scar.
scar
There
properly.
is a scar in the right chest. Okay. First, anything else in the chest before moving to the cardiovascular examination? Chest. Do you want to do anything else?
I need to do percussion on the axilla
Okay.
to see whether it's upper lobectomy or lower lobectomy.
Okay. Percussion.
Trachea.
There is
Mm.
no dullness. There is no dullness. Could be
Mm.
appreciated. Okay. Anything else in the examination?
Mm. Trachea is central.
Trachea is central.
Um, anything else in examination؟ لا مفيش حاجة تانية.
Okay.
Okay, then I need to examine the eye for any eye movement.
Okay. This is the eye with torch. This is his left eye with the
Okay,
torch.
dislocation of the
Yes.
lens.
Yes.
Then I need to open his mouth and see for the high arched palate.
There is high arched palate.
I need to examine for skeletal deformity on the back.
Okay. Time's up.
Hmm.
Okay. Now discussion with the examiner. Present
ايه
your
ده مفيش
positive
concern؟
finding. Time's up.
مفيش concern؟
Time's up.
ايه ده انت ما قلتليش 2 minutes remaining.
Two times up.
عليك.
Okay. Now
Hmm.
discussion with the examiner.
Hmm.
Present your positive finding.
Mr. Ahmed is 40 years old, presented with breathing discomfort, shortness of breath, as well as chest pain since last 1 week. He gave history before of shortness of breath. However, this time is more. It is mainly in the while lying flat and with activity and with exercise. And on examination, he is having disproportionate tall stature, as well as Marfan picture with some positive signs of rest sign and rest sign and thumb sign. He's having also anterior dislocation of his of his lens, and he's having high arched palate. He's
Is it
having
anterior
regarding
dislocation? Is it anterior dislocation?
دي posterior ولا ايه؟
What we
posterior.
what we call this upward.
اه سوري يا
Yes.
اختي بصي انا
Yes.
ضايعة
Continue.
خالص.
Continue.
Okay, and he's having high arched palate, as well as regarding his precordium, he's having collapsing pulse with I could appreciate pansystolic murmur on the apex radiated to the axilla. Most likely it's mitral regurgitation, as well as early diastolic murmur in the aortic area, left intercostal space, increase while patient sitting and deep expiration, most likely aortic regurgitation. And I could appreciate also scars on the on the right lower part. Um, um, this scar, most likely it is some drainage scar.
Okay.
Um, there is also left lateral thoracotomy scar with drainage scar. هادي غريبة أوي معرفش بصراحة.
It's only drainage scar, doctor. There is no
it is
thoracotomy scar. Okay.
تمام, it's drainage scar, okay.
Okay.
So most likely Mr. Ahmed is having Marfan syndrome with aortic regurgitation, as well as mitral regurg. I need
Okay.
also and I couldn't appreciate any abnormal breath sound suggestive of any pneumothorax.
Okay. So, what's your diagnosis here mainly of the acute shortness of breath, and what's your differential diagnosis?
Aortic regurgitation.
Acute,
Uh,
acute aortic regurg. What could be the cause?
in this patient, it will be because of the connective tissue disorder.
What can cause the
Aort
acute condition here?
Aortic root dilatation.
Okay.
mm,
Could be aortic dissection.
um, could be aortic dissection, but again, this patient doesn't have severe pain.
Okay. Could be maybe aortic aneurysm.
Could be aortic aneurysm.
Okay. Could be aortic regurg related to heart failure.
Yes,
Okay.
but I need to examine the base of the lung صحيح والlower
Okay.
limb.
Okay. And on the list of your list could be pneumothorax.
Mm. Could be
Okay.
pneumothorax.
Okay. What's the cause of the chronic shortness of breath in this patient?
Aortic regurgitation.
Could be related valvular disease. Okay. Could be anything else.
Yeah, mitral valve also.
Okay. Anything
Could
related
be
to the chest? Chest.
skeletal deformities.
Yes. Did you
Skeletal
examine? Yes.
deformities.
Yes. Did you examine for chest expansion here?
Oh, we have to examine also.
Yes. 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 About the aortic regurg, did you search for any other signs of aortic regurg in this patient, like Corrigan sign?
نسيت والله. كوريجان
Okay.
ساين لا.
Yes.
وريد جي بي
Did
بي.
you search for any signs of pulmonary hypertension could be related and could cause also the shortness of breath? Okay. So how would you like to manage this patient?
This patient need to confirm a diagnosis by genetic screening, and we need also to do
To manage this patient this time he is presenting to you with this shortness of breath.
okay.
How would you like to deal?
This patient need to be admitted in the hospital.
Okay.
We need to do urgent ECG as well as echo
Okay.
to see the valvular, the valve, as well as we need to do um, to rule out also aortic dissection. We need also to do a chest X-ray to rule out pneumothorax, and we need to do multidisciplinary team from cardiologist, respiratory, pulmonologist.
Okay.
بس يعني.
Okay. How would you like to rule out the aortic dissection?
Aortic dissection, how to rule out? By echo,
Other than
by
echo?
aortogram,
Yes.
aortogram.
Yes.
Mhm.
CT, aortogram. Yes. Yes.
Mhm.
Yes. Anything else you need to refer this patient maybe to?
Genetic counseling team,
O-
ophthalmologist,
Okay.
and
Okay.
as mhm.
Time's up, doctor. Very good. Very good. Very good.
Very good. إيه بقى